When somebody has diabetes, it means their pancreas is no longer able to produce all the insulin they need. We now know that cell doors won't open without insulin, and so the glucose can't get into the cells. And while the cells don't get any glucose, they're unable to produce energy. In the meantime, our blood is overloaded with glucose, all that glucose we got from eating. And when glucose doesn't go where it's meant to, it harms the body.
Diabetes is a disorder of metabolism that affects the way our bodies make use of what we eat and drink to produce the energy that we need. Simply put, diabetes is what happens when the body fails to process sugar correctly. Normally, the sugar we consume is digested and broken down to a simple sugar known as glucose. The glucose then circulates in your blood where it waits to enter the cells to be used as fuel. Insulin, a hormone produced by the pancreas, helps move the glucose into cells. A healthy pancreas regulates the amount of insulin based upon glucose levels. But with diabetes, this process breaks down.
When people have diabetes, the body's cells are locked, and the sugar that's in the blood can't enter the cells to give them energy. Since sugar can't get into the cells, it starts to build up in the bloodstream. High levels of blood sugar can lead to the common signs and symptoms of diabetes, including losing weight without trying, urinating more than usual, frequently being very thirsty, hungry, or tired, having blurry vision, having dry or itchy skin, tingling sensations in your hands or feet, and having sores that don't heal well.
In a person with type 1 diabetes, the pancreas produces little or no insulin. Without insulin, blood glucose levels rise. Without insulin, glucose cannot enter the cells and be used for energy. As a result, it remains in the bloodstream. As a person with type 1 diabetes, it is important to monitor and maintain healthy blood glucose levels. High blood glucose levels over a long period of time can lead to health complications. If your blood glucose level drops too low, even for a short amount of time, you may feel dizzy. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body's cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain healthy blood glucose levels. Over a long period of time, high blood glucose levels can lead to serious health complications such as heart attack and stroke, blindness, kidney failure, and nerve damage.
Gestational diabetes occurs when a woman's hormones reduce the effectiveness of her insulin. This happens only in pregnant women and is usually diagnosed between the 24th and 28th weeks of pregnancy. Let's look at how gestational diabetes develops. During pregnancy, the baby's nutrient center, the placenta, produces hormones like estrogen and cortisol that are vital to a child's development. In the last trimesters, the placenta secretes even more of these hormones to help the babies grow. Unfortunately, these pregnancy hormones can sometimes reduce the effectiveness of the mother's insulin. Without adequate insulin, blood sugar rises, resulting in the condition known as gestational diabetes.